Clinical pharmacy practice is the topic of this video. Pharmacist plays his role in this field along with doctors and nurses. Clinical pharmacy practice is a specialized area of pharmacy that focuses on the direct patient care aspects of medication therapy management. Clinical pharmacists work as part of the healthcare team alongside physicians, nurses, and other healthcare professionals to ensure the safe and effective use of medications in patient care. Their primary goal is to optimize medication therapy to achieve positive patient outcomes while minimizing adverse effects and drug-related problems. A brief information of key aspects of clinical pharmacy practice. Number 1. Medication review. Clinical pharmacists conduct comprehensive medication reviews to assess the appropriateness, safety, and effectiveness of a patient's drug therapy. They consider factors such as drug interactions, allergies, and patient history. Number 2. Medication therapy management. Clinical pharmacists collaborate with healthcare providers to develop and implement medication therapy plans tailored to individual patient needs. They may adjust dosages, select appropriate medications, and monitor patient responses. Number 3. Patient counseling. Clinical pharmacists provide education and counseling to patients and their caregivers about their medications, including how to take them, patient side effects, and the importance of adherence to treatment regimens. Number 4. Drug information. They serve as a valuable resource for healthcare professionals, providing evidence-based drug information and recommendations to guide treatment decisions. Number 5. Monitoring and assessment. Clinical pharmacists continually monitor patients' progress and response to medication therapy. They may order and interpret laboratory tests to assess medication efficacy and safety. Number 6. Preventing medication errors. Clinical pharmacists play a crucial role in reducing medication errors by verifying prescriptions, ensuring proper labeling, and providing guidance on medication administration. Number 7. Pharmacotherapy consultations. They participate in patient rounds in hospitals, providing input on medication selection and dosage adjustments, particularly for complex cases. Number 9. Management of chronic conditions. Clinical pharmacists often work with patients managing chronic diseases such as diabetes, hypertension, and asthma to optimize medication regimens and improve disease management. Number 9. Collaborative care. They collaborate with other healthcare professionals to develop interdisciplinary care plans that address all aspects of a patient's health. Number 10. Research and quality improvement. Clinical pharmacists may engage in research and quality improvement projects to enhance medication-related outcomes and healthcare practices. Conclusion. Clinical pharmacy practice is common in hospitals, ambulatory care settings, primary care clinics, and other healthcare facilities. It is an essential component of patient centered care and contributes to improving healthcare quality, reducing healthcare costs, and enhancing patient safety. Clinical pharmacists must stay up to date with the latest research, guidelines, and advancements in pharmacotherapy to provide the best possible care to patients. At the last, if you like this video, please share it and subscribe my channel Javed Khatak Pharmacy. Thanks a lot.